And as Nigeria gradually eases the lockdown measures, a curfew from 8 p.m. to 6 a.m. was put in place by President Muhammadu Buhari to restrict movement and curb the spread of the virus. Public Affairs Analyst Ambrose Igboke joins me now to discuss the level of compliance. Good to have you join us, Ambrose Igboke. When you look at the level of compliance with the directive, whether it's the wearing of face masks or social distancing during the day, and then the curfew, which runs from 8 p.m. to 6 a.m. at night, how effective would you say that this curfew has been in curtailing the spread of the virus?
Thank you, Precious. First of all, the whole activities that are geared towards the curbing of the coronavirus in Nigeria has a much of a copy and paste approach. By this time, it is time for us to actually look deeply into how we can develop our own homegrown approaches to this issue. Because first of all, there have been issues about the face mask. Most of the face masks being used around are not the N95 face masks that are actually meant for COVID-19 to prevent the virus. Most of the face masks we use are so loose, they don't even have layers in between them. And then you can breathe out and breathe in from them, which means that the virus can easily be admitted into your body system while using the virus. But when I would talk to people, people say, well, half bread is better than none. The Nigerians are used to being half bread or none at all. So, but this is not the time for half bread. This is the time to actually go all out to develop some homegrown strategies. Now, coming to the lockdown cannot be forever. Even the Western nations that initiated the lockdown have started saying that it's not practicable because this virus have come to stay. So we have to examine the socio-economic impact of this lockdown, and then start developing strategies that can help us ameliorate the situation and help us live with the virus, because the virus is not going anywhere. The virus has come to stay. Therefore, just like any other infectious disease that have come to stay, how do we start managing them? How do we start having homegrown solutions like the herbs? Like the governor of your state last time did talk about how he used herbs to cure his own COVID-19 issue. Why have we not accepted that? Why have we not tested it? The biotechnologist, Professor Morris Iwu, once told us that he has the solution for this COVID-19. Why have we not gone that way? Also, the Reverend Father Dr. Madodo of the Pax Hebas has said that he went to Governor Obaseki last week, and they said they have this solution. Why is the PTF not looking towards this direction? So there's much to desire. Let's speed up our own solution. They are talking about which is the US solution, which has not even been accepted by the FDA in the United States. And they're telling us here that that is the solution they are going to use. So it is time to actually go down to the ground route and we start, looking at homegrown solutions. Coming to the curfew. Well, I don't see the rationale. They are allowing people go to the market, go to the offices in the daytime for 10, 12 hours, and then they come back to the house, and you tell them from 8 they shouldn't move. Somebody has jokingly said, does the virus go to sleep in the daytime and then come back to attack us at night? Is that why there is this night curfew? But some are saying that it is because of the interstate travels. And that is failure of the security outfit. If there are still interstate travel in the night, the population that are inside the state, should not be punished for it. We should not stop people's movement. You can only say, okay, social distancing, like the clubs that have been banned, worship center, that place that will make people congregate. Those are the places we say, okay, let's people.
Mr. Ambrose Igboke, allow me butt in here. I want to ask you a question because, again, yesterday there were reports of heavy traffic in Lagos, even beyond the curfew time. And you have talked about homegrown strategies. Beyond the herbs that you are saying we should use for treatment, what other homegrown strategies do you think we can apply at this time?
Well, I don't know why the various states just took the prescriptions of the PTF, hook, line, and sinker. I remember reading that document, and towards the end of that document, the PTF did say that state governments are at liberty to implement that directive according to the peculiarities of their states. So I didn't expect the Lagos state government to say curfew stops that there's recovery from 8 o'clock, knowing the peculiarity of Lagos State. Lagos State was supposed to have a maybe from 10, because by 8 o'clock, Lagos State, a Lagos that is economically active cannot go to sleep by 8 o'clock. So it's impracticable in Lagos. Therefore, they'll continue to have this problem. The other time I watched in the news how even the commissioner refused people on essential duty like journalists to have a passage. And that is a big problem. Therefore, they should re-examine this and see how they can come up with solutions that are based on what is working in Abuja. May not work here because Abuja is essentially a civil service entity, while Lagos is a commercial entity with the private sector. Therefore, it cannot work. So if you are easing the lockdown, ease the lockdown, let's know what is happening. Put some parameters to check them.
Mr. Ambrose Igboke, I'm afraid we do have to leave it there at this time. Public Affairs Analyst Ambrose Igboke, thanks for sharing your perspective with